Hi everyone, I'm consultant plastic surgeon from Shushra Institute of Plastic Reconstructive and Aesthetic Surgery, Allied Mission Hospital, Thrissur. So today we'll be speaking on gynecomastia problem in man, also known as male boobs. So how can it be corrected and how effective is plastic surgery in its correction? So what is gynecomastia? It's the development of breast gland, or it can be a development of fatty breast in a male, which is called pseudo-gynecomastia. Frequently, it's a combination of both. What causes gynecomastia? The causes of gynecomastia are varied. The development of breast gland in man can be normal, and there are three age groups in which this can occur usually. 1. At birth, puberty, in old age. In addition to this, gynecomastia can be caused by medications, kidney disease, liver disease, as well as some illicit over-the-counter drugs. However, it's important to remember in 70% of cases, no cause of gynecomastia is found. How do you treat gynecomastia? Treatment depends upon the type of gynecomastia and its underlying cause. For example, if it's a medication that's causing it, then switching to an alternate medication, and the most effective way of treating true gynecomastia is through surgery. If it is a pseudo-gynecomastia, that is a fatty breast without a gland, then the treatment may simply be diet and exercise, or frequently surgery, which commonly is liposuction. What is gynecomastia surgery and how successful is it? The surgery depends largely on what the underlying issue is. If it is a true gynecomastia and there is a breast gland or a breast lump, then surgery involves simply excising this one. This involves a scar just either around the nipple or on the side of the chest wall. If the gynecomastia is made up of a fatty tissue and more correctly called pseudogynecomastia, then the surgery involves liposuction. Frequently, it's a combination of both gland and fatty tissue, so both techniques need to be used. In a small proportion of cases, there is also an excess amount of skin which needs to be excised. In our technique that we follow in our hospital, patient will first undergo liposuction, which allows removal of the fat. Then in same operation, we make a cut either around the nipple or the side of the chest wall to remove the gland. Thereafter, the patients are allowed to recover, and if necessary, after a period of 10 to 12 months, they may undergo a skin excision to remove the loose skin. Though in our experience, most patients doesn't need it. Chances of recurrence from gynecomastia are low unless the precipitating factor is still present. For example, if the gynecomastia is a result of patient taking a particular medication and they are still continuing it, then the chances of it coming back is a little bit higher. What is recovery like after gynecomastia surgery? Recovery is fairly quick, and gynecomastia surgery is done as a daycare procedure under general anesthesia. Once the procedure is over, patient wears a compression garment for 3 weeks. Minimal sutures are present, which are to be removed after 2 weeks. There are no drains, and patient go home with some simple painkillers and antibiotics. Our advice is to avoid undertaking any heavy lifting or going to the gym for a couple of weeks. Most patients are back at work in about 3 to 4 days and can drive after 5 to 7 days. The sutures are removed at 2 weeks, and thereafter the patients builds up their activity, returning back to full range of normal activity between 4 to 6 weeks. Results take a little bit longer as the swelling can take a few months to settle down. So this is a case of gynecomastia who has got operated in our department. On the left side is a pre-operative photo, and he's having a grade 2B gynecomastia, and he has undergone liposuction and the gland excision. And on the right side is the picture of the same patient after surgery. This is another patient who has undergone a similar procedure of liposuction plus gland excision, and these are the pre-operative and post-operative picture of that patient. Thank you for listening to our session. Hope you understood with the content. If you have any queries, please log on to our website. Thank you.